Today, we will discuss antipsychotic drugs, which are used to treat psychiatric conditions like schizophrenia and bipolar disorder. These medications work by affecting neurotransmitter systems in the brain, such as dopamine and serotonin. We will also cover topics like drug metabolism, potential interactions, and genetic variations that can impact individual responses to these drugs. Let's dive into the fascinating world of antipsychotic pharmacology. Antipsychotic drugs alleviate symptoms of psychosis by blocking dopamine D2 receptors in the brain. This helps reduce symptoms like hallucinations and delusions associated with schizophrenia. These drugs also restore frontal cortical activity, improving negative symptoms and cognitive impairments. Mechanisms of action involve complex interactions with different receptor subtypes. The mechanism of action of antipsychotic drugs involves more than just dopamine receptor blockade. While older first-generation antipsychotics predominantly target dopamine receptors, second-generation, or atypical, antipsychotics exhibit additional interactions with other neurotransmitter systems. These include the blockade of serotonin receptors, particularly 5-HT2A receptors, which is thought to contribute to their improved effectiveness against negative symptoms and reduced risk of extrapyramidal side effects. In addition, antipsychotics may also interact with alpha-adrenergic, histaminergic, and muscarinic receptors to varying extents, leading to their wide-ranging side effect profiles. Antipsychotic drugs modulate serotonin receptors, including 5-HT2A, 5-HT1A, and 5-HT2C subtypes. Activation of 5-HT1A receptors may have anxiolytic and antidepressant effects, while antagonism of 5-HT2C receptors may cause weight gain. These drugs target specific receptor subtypes to customize treatment based on symptoms and side effects. Atypical antipsychotics, also known as second-generation antipsychotics, have revolutionized the treatment of schizophrenia and other psychotic disorders. These medications differ from their first-generation counterparts in their receptor binding profiles and mechanisms of action. Besides dopamine receptor blockade, atypical antipsychotics exhibit high affinity for serotonin receptors, leading to their broader spectrum of activity and reduced propensity for extrapyramidal side effects. They are characterized by their efficacy against both positive and negative symptoms of schizophrenia and may also be utilized in the management of bipolar disorder, depression, and anxiety disorders. To truly grasp the complexities of second-generation antipsychotics, one must consider their unique receptor binding profiles. For instance, risperidone exhibits strong affinity for both dopamine D2 and serotonin 5-HT2A receptors. Another example is olanzapine, which binds to a myriad of receptors including D2, 5-HT2A, 5-HT2C, alpha-1 adrenergic, histaminergic, and muscarinic receptors. Each medication's distinct binding affinities translate into variations in efficacy, side effect profiles, and potential drug interactions. Hence, tailoring the choice of an atypical antipsychotic to a patient's symptomatology and individual characteristics is paramount for optimal treatment outcomes. Beyond dopamine and serotonin, antipsychotic drugs may also have effects on other neurotransmitter systems. For instance, the antagonism of alpha-1 adrenergic receptors by certain antipsychotics contributes to orthostatic hypotension and sedation. Additionally, blockade of histaminergic H1 receptors may underlie the sedative effects experienced with many of these medications. Furthermore, antagonism of muscarinic receptors can lead to anticholinergic side effects, such as dry mouth, blurred vision, and constipation. Understanding the impact of antipsychotics on these neurotransmitter systems helps elucidate their side effect profiles and potential interactions with other medications. Antipsychotic drugs are processed differently in the body based on their properties. Factors like lipid solubility and protein binding influence their absorption, distribution, metabolism, and excretion. The liver metabolizes these drugs using cytochrome P450 enzymes, producing active byproducts that affect their effectiveness and duration of action. Kidneys eliminate antipsychotics and their byproducts. Understanding these pharmacokinetic features is crucial for prescribing, avoiding drug interactions, and choosing appropriate antipsychotics for patients with specific conditions or liver/kidney issues. Understanding how antipsychotic drugs interact with target receptors is crucial for understanding their effects. Antipsychotics bind to specific amino acid residues in receptor proteins, causing changes in receptor signaling. Dopamine receptor antagonism involves forming hydrogen bonds and hydrophobic interactions with receptor residues. By targeting and stabilizing specific receptor conformations, antipsychotics can alter neuronal activity. This affects neurotransmission, leading to therapeutic benefits and potential side effects. The selectivity and affinities of antipsychotic drugs for specific receptors impact their effectiveness and side effects. High affinity for dopamine D2 receptors improves efficacy but increases the risk of side effects. Serotonin 5-HT2A receptor affinity affects the drug's ability to treat positive and negative symptoms of psychosis. Achieving the right receptor selectivity is crucial for optimizing therapeutic effects and minimizing adverse events. Antipsychotic drugs are subject to various metabolic pathways, predominantly mediated by hepatic cytochrome P450 enzymes, including CYP2D6 and CYP3A4. Genetic polymorphisms in these enzymes can result in significant inter-individual variability in drug metabolism rates. Furthermore, drug interactions can occur via enzyme induction or inhibition, potentially affecting antipsychotic plasma concentrations and therapeutic efficacy. The risk of adverse effects and drug-drug interactions must be carefully considered, especially in patients requiring concomitant medications known to interact with antipsychotics. Gene polymorphisms, particularly those affecting drug metabolizing enzymes and drug targets/receptors, can influence an individual's response to antipsychotic therapy. For example, poor metabolizer individuals with CYP2D6 enzyme deficiency may experience higher plasma concentrations of certain antipsychotics, increasing the risk of adverse events. Similarly, genetic variations in dopamine and serotonin receptors can impact drug binding affinities and alter treatment outcomes. Pharmacogenomic testing allows clinicians to personalize therapy based on an individual's genetic makeup, optimizing treatment effectiveness and reducing the likelihood of debilitating side effects. Prolonged use of antipsychotic drugs can lead to receptor adaptations within the brain, influencing treatment response and the emergence of side effects. For instance, upregulation of dopamine receptors may occur in response to chronic blockade, potentially leading to increased sensitivity and the manifestation of tardive dyskinesia. Similarly, upregulation of 5-HT2A receptors has been implicated in the development of tolerance to the drug's therapeutic effects. Understanding these receptor adaptations is crucial for managing long-term antipsychotic therapy and guiding strategies to minimize adverse events. Antipsychotic drugs block dopamine and modulate serotonin receptors, with factors like drug selectivity, pharmacokinetics, gene variations, and receptor adaptations affecting their efficacy and side effects. Understanding these mechanisms can improve treatment for schizophrenia and psychiatric conditions.